and welcome to another interesting edition of HealthWatch. This is a program that focuses on the health of women, men and children. On today's episode, we have three interesting stories. First, we have a feature on cervical cancer. Cervical cancer is still a threat to women, especially women above the age of 30. And also, we are looking at the challenges that are facing the dental profession. There are different divisions in the dental profession. We have the dental therapist, we have the dental surgeon, and so on. So today, we have a feature that will be telling us about the challenges that we're facing this profession. Plus, on the Life and the Where, we are talking about the benefits of agbalumo, the popular African apple seed you know. My name is Nkem Okibe, and you're welcome to this week's edition of HealthWatch. We'll go on a short break. We'll be right back. Stay with us.
Cervical cancer is a kind of cancer you can be exposed to if you're a woman. That's where I'm going to start, because some women think that they are immune to cervical cancer. Once you have a cervix, then you can have a cervical cancer. And what's the cervix? The cervix is said to be the lower part of the womb, or what you call the neck of the womb. And then that is that opening through which when a man and a woman meet, the ejaculate go into the womb. And that's the part that is exposed. That part is where they usually have issues when it comes to cervical cancer. Now, when there's abnormal growth at the cervix, that is what we call cervical cancer. And now this cervical cancer is something that is not as rare as people think. There's an organism that has been implicated in cervical cancer. It is called the human papilloma virus. Now, human papilloma virus is a virus that is found in some other conditions, like WAT and all that. But in the case of cervical cancer, it has been implicated in most cases of cervical cancer. There's a recent research in Lagos State, and then if you're talking about Lagos State and you're having this kind of research, you know that there are other states, you don't know what you're going to talk about there. Now, only 2% of women in Lagos State have done a pap smear. Now, we say every woman is supposed to have a pap smear at least once in 3 years. At least once in 3 years, if you are less than 60 years old. But if you're more than 60 years, you have it yearly. Now, the pap smear is something that women are supposed to do, but only about 2% have done it. In fact, the research shown that just about 37% of women in Lagos have heard or known anything about cervical cancer, or have some idea what it is. Now, but another a cancer center have done a research in Lagos and found out that about 22% of women actually have HPV. So that tells you that there's a gap, a huge gap. If you're a woman and you have a cervix, and you have not had a pap smear, you cannot be sure whether you have cervical cancer or not. When it comes to non-communicable diseases, there is no sign. That's the way to answer it. Most time, people don't have any sign or symptom. Now, the symptom you have, or the sign you have sometimes, sign or symptom, is just bleeding. But that bleeding can happen in some other diseases. So don't wait for the sign. Get a test. That's the way to do it. Every woman is supposed to have a pap smear to know whether he has an HPV or not. People don't know that there's vaccine. There's actually vaccine for cervical cancer. It's highly accessible, and then people are taking it. We give it to people. Okay, You take it, you come back, then 3 doses. Once you take 3 doses, you are, because let me say, in cervical cancer, there's some strain of HPV that have been implicated, 16, 18, and then there's a vaccine we call Cervarix. That's one we have in Nigeria, and that's cover for those strain of HPV. Now in the US, they have a bigger one. They have more strain cover. It's called Gardasil. But at least if you have a Cervarix, you have a huge chance of never having cervical cancer. Women who are sexually active, if a woman and you're having sex, you are at risk of cervical cancer, because cervical cancer itself is associated with multiple sexual partner, or even if you have a single sexual partner but you're having sex, if the person have it, then it can transfer it to you. But it's associated more with multiple sexual partner. Women that started having sex early in life are at higher risk. If you start having sex early at 12, at 13, which is happening today, in today's world, everybody talk about my boyfriend, I don't know. So if women are talking about their boyfriend, ladies, listen to me, you're talking about your boyfriend, that means that you have a risk of cervical cancer. Because the thing is this, when the HPV is in men, the worst it can cause is to cause just a swelling. HPV is a virus. It can be found in men and women. Okay, when it is in men, it cannot cause a cancer because men don't have a cervix. So a man have HPV in his body, he sleeps with a lady, he transfers it, and the lady has cervical cancer, but he is going free. Okay, so that's why it has been associated with multiple sexual partner, and when he starts having sex early, also use of OCP, oral contraceptive. But some research have shown that might be because it's people that usually have multiple sexual that use OCP. Take home message for everybody: get a screening. Okay, we do this all the time. We do it for organization, we do it for individuals, we do it in our center and all that. Because if you don't do a screening, you cannot know whether you have a cervical cancer or not. But the thing is, cervical cancer is, let me make you happy, this is one of the cancer that is easily treatable. Prevention is the way to go, especially for a country like Nigeria. Don't wait until when a mother in your house or your sister have a cancer, everybody is running a skater. The last time some people came to me and then somebody had a breast cancer and they said they were looking for money, and by the time I asked them 1 or 2 questions, I already know that person is in stage 4, and I already know that person is going to die. I know in Nigeria, even in the US, at stage 4, you will likely not make it. So, but if you find a breast cancer, for instance, in stage 1, very easy. More than 80% of people will live. Just take off the cancer and then do other things. So we need to, what I find in this country is that people are more into cure. I have headache, I have fever. But these are not the things that is killing. What is killing us today is not fever and headache. It's not malaria, typhoid like that. It's a non-communicable diseases. It's hypertension, it's cervical cancer, it's a breast cancer, it's all these things. And we can prevent it. People spend money to service their car. People spend money to service their generator. People spend money to service things they use in their house, but they spend money to destroy their body. So we need to start, there need to be a paradigm shift. People need to know that my body, this is the most important thing in me. If this thing is gone, every other thing is gone. So spend money, do your screening, take your vaccines. So take all the vaccines you need, take all the prevention you need, eat the right way, live the right way, and you'll be better.
So I'm sure you learned a lot of things from the feature we just showed on cervical cancer. You need to go out and screen. It's better for you to know your status. Up next is the feature talking about the challenges facing the dental profession in Nigeria. Your mouth is the gateway of your entire body. It boosts your level of confidence and happiness. To this end, the mouth needs to be properly taken care of.
When you look at oral health, is very important to the general health of the body. When the mouth is dirty, no matter how sweet or delicious any food you put into the mouth, it is infected. So it is very, very important you take care of your mouth.
Oral hygiene simply means how you take care of your mouth, your oral cavity. That is the cleanliness of your teeth, the healthy nature of the structures, like the soft tissues, the gums, the tongue, even the throat. How you take care of them.
The medical professional who takes care of the teeth is called a dentist, while dentistry is a branch of medicine that deals with diagnosis, prevention and treatment of diseases and malformation of the teeth, gums and oral cavity. There are several career options under dentistry. This includes dental therapist, dental nurse, dental surgery assistant and dental surgeon. Just as they have different names, they also have their area of specialty and face same challenges.
Well, one of the challenges, I felt that our government should legislate more acts to give these children an opportunity to practice what they have gone for. For example, in a local government, we have 774 local governments in the country. They should be able to employ a dental health officer. Just as we have pharmacists, medical doctors, there should be a dental health officer that will be moving from one health center to another.
Some of the challenges we've always had, there had always been conflict of duties. Before a dental surgeon practices anything, the ethics says a patient must go through a dental therapist to ensure that the environment under which the doctor is going to carry out subsequent procedure is made very clean. Some dental clinics, they bring in even cleaners, and they according to them, they train them on the job and do something that I used 4 or 5 years to do. The way forward is that everybody should be allowed to do their job. Dental surgeon, you are supposed to be the administrative person, and then maybe probably you carry out the highest degree of the job. You understand? Like maybe probably a tooth is being removed, want to replace. You take all the measurements, send them to the lab for lab to produce an artificial one that the patient wears. You understand? And then a dental therapist finishes her job. Maybe the patient has some other ailments that needed to be seen by the surgeon, and the surgeon now sees. Let us all do our job.
Every year, new set of medical professionals go into the labor market.
Dental profession is becoming very, very recognizable in the sense that we now have all the various divisions of dental professions in dentistry. You have apart from the dental surgeon, you have the dental therapist, you have the dental nurse, the dental surgery assistant, the dental technician, and also, so we are upcoming.
I think the profession is all about your personal skills and your ability to invent new things. And for fresh graduates, I think my personal advice to them is just invent new things, be creative on your own. There are so many ways to make money. You can do mobile dental clinic, you can do private practice while you're trying to get government jobs. You can also do house-to-house treatments, do outreaches, churches, mosques, marketplaces, and these are good strategic places where so many people don't even have the knowledge of how to take care of their mouth. So these people are well, I say they are one of our most important patients, but they get the least of the information we have about the mouth.
The dental profession also has a body that regulates and guides their mode of operation.
Today marks a call for you to stand tall in integrity, to be honest in character, to be professional in service, and to be high in ethics and standards. It should be noted that we are maintaining and we continue to maintain zero tolerance to quackery.
The dental profession is a noble one, and as such, the government needs to make adequate provision to absorb them in health centers both local and federal level. On a Life and a Word this week, we're looking at a fruit that I love this fruit, actually. Personally, I love this fruit. But this is one fruit that everyone loves. Women, men, children. I'm talking about the popular African apple fruit, which is known as agbalumo. Enjoy this feature. We'll be right back.
Fruits is a popular name that rings a bell in the ear of humans, both young and old. Nigeria is a country that is abundantly blessed with different kinds of fruits. Everybody knows the importance of fruits as a part of a balanced diet. Eating a healthy amount of fruits improves weight loss. One of such fruit is African star fruit. African star fruit, botanically called Chrysophyllum albidum, which belongs to the Sapotacea family, found throughout tropical Africa, is popularly known as agbalumo in Yoruba, udara in Igbo.
It's very tasty and it has some nutritional benefits, and also the sensory properties like the sourness of it. It has one unique taste compared to other fruits. So sometimes I feel satisfied and sometimes I crave for more. The more I taste it or have it, the more I want to have a taste of it.
Fell in love eating it. I don't know what is really working inside someone's body, but just because of the good taste, that's why I fell in love eating it.
I eat agbalumo because it is nice. The taste is very lovely. It's different from most fruits you see. And as it's a seasonal fruit, you look forward to it coming every year, because you don't see it like from beginning to the end like some fruits like orange, pineapple. Then when I eat it, I feel happy and relaxed, especially when you put it in fridge to be a bit cold.
It is a seasonal fruit from January to April. It's normally consumed because of its nutritional value, both in rural and urban areas of the country.
African star fruit is a fleshy fruit that has seeds shaped in a star way. It's one of the citrus family. Well, everybody can take African star fruits: boys, girls, pregnant women, the young folks, the old folks. Anyone can have African star fruits.
However, African star fruit business does not require a lot of capital to start. This fruit is always stored in the market or packed in a basket and set up in strategic position in a public place.
This one 300 naira, this one 20 naira, so this one 30 naira. We usually bring it from the K2 side, so that's where we used to get it.
According to the dietitian Miracle Ebenezer, eating a serving of African star fruits contributes 3 grams of fiber to the recommended daily intake of 25 to 38 grams. These fibers provide bulk of your diet, protect you from diabetes and some forms of cancer. It also serves as natural source of antioxidant booster to remove free radicals from oxidative stress disorders.
The effects of consuming high levels of vitamin C. So when you take approximately like 4 bowls of the African star fruit is equal 100 grams. So that means you are taking 25 grams of vitamin C, and per day you're supposed to consume at least 1,000 milligrams of vitamin C. When you do a conversion, you might even be taking more than you're supposed to do that per day. So when you do more than that, it might lead to high toxicity in the blood.
In all, consumption of fruits and food should be taken in moderation, because excessive intake of agbalumo could lead to heartburn.
10 benefits to drinking warm lemon water every morning. Did you know that lemon juice could be helpful to your health in many different ways? Lemons are full of vitamins and nutrients like vitamin C, B-complex vitamins, calcium, potassium, iron, magnesium, and fiber. If you're ready to take a drink of lemon juice, make sure to mix it with water first. Lemon juice can be tough on your teeth if you drink it straight. Drink it right away in the morning and then wait 15 to 30 minutes before eating breakfast. This will make sure you get the full help of lemon water. Why should you drink lemon water? Here are a few reasons. 1. Gives your immune system a boost. Lemon juice has a lot of vitamin C, which helps your immune system. Also, when you're stressed, your vitamin C level will drop, so taking vitamin C is a good idea for stressful days. 2. Excellent source of potassium. Because lemons are full of potassium, they are great to keep your heart, brain, and nerves running smoothly. 3. Aids digestion. Lemon juice is good for digestion because it helps loosen and remove toxins in your stomach. It also helps lessen indigestion signs like heartburn, burping, and bloating. 4. Cleanses your system. By removing the bad chemicals in your body, lemon juice helps the liver work properly. 5. Freshens your breath. Lemon juice also helps ease toothaches and gingivitis. However, because lemon juice is hard on tooth enamel, don't brush your teeth after drinking lemon water, or brush them right before instead. 6. Keeps your skin blemish-free. The antioxidants in lemon juice will help lessen blemishes and wrinkles. It can also be put on scars and age spots to lighten them. Since it forces bad chemicals out of your blood, it will also keep your skin glowing. 7. Helps you lose weight. Because lemon juice has pectin fiber, it can stop you from feeling hungry, and in this way, help you lose weight. 8. Reduces inflammation. If you drink it all the time, lemon water will lessen the amount of acid in your body and stop you from getting sick. It also stops swelling by getting rid of the uric acid in your joints. 9. Gives you an energy boost. Lemon juice gives your body energy when it reaches your digestive tract. It can also help lessen anxiety and depression. In fact, even smelling lemons will calm your nervous system. 10. Helps fight viral infections. Drinking lemon water is one of the best ways to lessen viral infections and soothe the sore throat they bring with them. Also, because it helps keep your immune system up, it can fight the infection at the same time. Lemon juice has so many great uses, and it's also the easiest, biggest change you can make for your health.
And that brings us to the end of this week's edition of HealthWatch. Send us a mail to kibenkem@gmail.com, HealthWatch, NTA Lagos Channel 10 @gmail.com, or send the text only to 07060865487. Remember that health-conscious people live longer. Thank you for being part of this week's edition. See you next week. My name is Nkem Okibe.